Unported.
Hi.
How are you?
I'm good. How are you?
I'm good. Thank you for asking. Okay, let's go ahead and look at your chart. You were here about 2 weeks ago. And what happened in the meanwhile?
In between then, I kind of had, the last 2 weeks I've been having some abdominal pain, mostly on the left side. And it kind of comes and goes, but it's mostly here.
And on a scale of 0 to 10, how would you rate it?
When it's at its worst, I'd probably say a 7.
Okay. Is it worse after meals, in the morning, in the evening?
In the evening, it's worse.
And how would you describe the pain? Is it sharp, dull?
I'd say it can be a little sharp, on the sharper side.
Okay. And are you taking any medications?
No, not for the pain.
Okay. Are you taking any medications on a daily basis?
Yeah, I have some vitamins as well as an iron supplement.
Iron. Okay. For how long have you been taking iron?
About a year.
A year. Were you diagnosed with anemia?
Yeah.
Okay. And okay, I don't think we checked your hemoglobin recently, so I'm gonna do that and ferritin levels, just to make sure that if your anemia is resolved, perhaps you do not need to take iron anymore.
Okay.
Okay. Do you have any history of GI bleeding? Any reflux?
No.
Okay. Hernia?
No.
Pancreatitis?
No.
Okay. And is this the first time that's been happening to you, or have you had this before?
This is the first time.
First time. Okay. All right. Let's see how your vitals look. And is it okay if I put
Yeah,
the
that's
cup
fine.
over here? Okay. Okay. Blood pressure is 121/75. It is normal, but the last time you were here, your blood pressure was kind of on the low side, so that could indicate why your blood pressure is a little bit elevated. The pain can elevate the blood pressure slightly.
Okay.
And I'm going to go ahead and put this on your index finger. Okay. Okay, and while this is recording, I'm going to check your pupils. So go ahead and look straight at my nose. Okay, so I'm just doing a general checkup to make sure that everything is in order. Okay, very good. So eyes, I did not see any movements. All right, I'm going to go ahead and press with one hand over here on your cheek, and I'm going to have you look this way now, okay? Okay, good. And same thing, and now I'm going to have you look that way. Okay, and now look this way. Okay, so very good. And while that is still recording, I'm going to check you for color deficiency. And I'm going to ask you to tell me what number you see right here.
I see 12.
Good. And here on the left.
8, 6,
Okay.
97,
Good.
45.
45. And what number do you see here?
I don't see a number.
Okay. What about here?
Neither there.
Okay. So I'm going to have you trace from this X all the way here. Okay. And can you now please follow the line?
Yeah.
Okay. That was very good. And oxygenation is 99th percentile on room air, heart rate is 74, resting. Okay, so I'm going to go ahead and check your smell. Go ahead and close your eyes for me, please. And I'm going to go ahead and just close one ear. Can you take a deep breath in through your nose and try to identify the smell?
Kind of smells lemony, kind of citrusy.
Okay, that was very good. And same thing on the other side. Take a deep breath in and breathe out.
Kind of smells like fresh linen.
Okay, and one more. Take a deep breath in and breathe out.
Smells like coffee. Coffee
Perfect.
beans.
Okay, let's go on and check your taste as well. I'm going to put one drop on your tongue.
It kind of tastes herbally. Kind of
Okay.
tastes like a green tea.
Okay. And one more.
Kind of tastes minty.
Okay. So that looks very good. I have no concerns there. I'm going to go ahead and check your facial sensation.
Okay.
Have you noticed anything abnormal, any pain?
No, other than just my abdomen. Everything
Okay.
else is fine.
Can you please tell me if you feel this?
Yep.
Okay. And what about this?
Yep.
And what about this?
Yes.
Okay. Did you feel that equally on both sides?
Yeah.
All right. And now I'm going to perform a sharp or dull test. So I'm going to go ahead and show you what dull means. This is what dull will feel like.
Okay.
And this is what sharp will feel like.
All right.
Okay.
Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull. Dull.
Okay. And I'll take a look inside your ears too. I'm noticing a little bit of redness, but we can just keep an eye on that.
Mm-hmm.
Okay. So everything looks good, very good. I'm going to have you lay down now,
Okay.
and I will examine your abdomen. Okay. I'm sorry for my stethoscope. It's going to feel a little bit cold. But I'll just listen to your abdomen first. Normal bowel sounds heard in all 4 quadrants. Okay. And is it okay if I open up the pants a little bit to have access to the lower side? Okay. I'm going to go ahead and percuss on your abdomen. Let me know if you feel any kind of pain. Okay.
There's a little pain right there.
Over here.
Mm-hmm.
Does it hurt when I press down over here?
A little, yeah.
No diastasis recti, which means no separation between your abdominal walls, left and right. And no signs of umbilical hernia. I'm pressing down on your liver now. And I'm not feeling any organ enlargement. Pressing down on your rib cage as well. Okay, what I'll do now is I will do a deep palpation. Let me know if you feel any pain.
There's a little pain there.
Okay. I did feel a little bit of a swollen lump, but it could also be just from your bowels. So after we do an x-ray, we're definitely going to have a better picture. And also I would like to run an ultrasound just to make sure that we see everything in detail. Okay. Any pain as I'm pressing down? Okay. I'm gonna go ahead and take a few measurements.
All right.
Okay, I'm checking for any inflammation. Three. Okay. Okay. Looking for any pulsations, any signs of any inflammation. Also looking for any skin discolorations, which would indicate poor perfusion and maybe some blockages going on. perform a sensitivity test. So I'm going to go ahead and use the brush. Can you please tell me if you feel it on the right or on the left?
Sure. Right side. Left. Right. Left. 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 Right. Right side. Right side. Right. Right side. Left side. Left. 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 Right. 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 Left. 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 Right.
Okay. Perfect. And now I will touch you with a sharp or a dull object. This is what sharp is going to feel like. And this is what dull is going to feel like.
All right.
Okay.
Sharp. Dull. Dull. Sharp.
Was that very painful on that side?
A little.
Okay.
Not very. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull.
Okay. Now now I'm going to go ahead and test how your body perceives the cold stimulus. I did notice some abnormalities on how you perceive the sharp or dull, and I'm going to focus mainly on those areas, okay? Okay, so go ahead and tell me if you feel this.
Yep. Yep.
Okay, and now I will draw a straight line and tell me if you feel it cold or warm.
Warm.
Okay, and now I'll touch you with a different texture. Tell me if it feels cold or warm.
Cold.
Okay, and I'll do the same thing on the other side. Tell me if you feel this.
Yep.
Okay, and what about this?
Yes.
Okay, and now draw a straight line. Tell me if you feel it cold or warm.
Cold.
Cold, good. And tell me if you feel this cold or warm.
Warm.
Good, okay. And now go ahead and tell me on the left side if the cold feeling changes in temperature, if it becomes warmer at any point.
All right. Feels warm.
It feels warm all the way.
Yeah.
Okay.
Warm. Warm.
Still warm. Is it still warm?
Cold.
Cold. Cold or warm?
Cold.
Does it change temperature?
No. Cold. Cold.
Okay. And now I will do the same thing, but I will touch you with even a softer texture. So you will barely be able to feel it,
Okay.
but you should be able to feel it. And then I will use a even sharper object to make sure that your body can perceive the painful stimuli, okay? Okay. Sharp or dull?
Sharp.
Sharp. Okay. So now that was good. Sharp or dull? Dull. Dull. Perfect. Okay. Sharp or dull?
Sharp.
Sharp. Good. Sharp or dull?
Dull.
Dull. Sharp or dull?
Dull.
Good. Sharp or dull?
Sharp.
Good. Sharp or dull?
Dull.
Dull. Sharp or dull?
Sharp.
Okay. Sharp or dull?
Sharp.
Okay, good. Sharp or dull?
Sharp.
Good. Sharp or dull?
Sharp.
Good. Sharp or dull?
Dull.
Dull. Good. Okay.
Sharp.
Sharp. Is that very painful?
No.
No. Okay. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Dull. Okay. Sharp or dull?
Sharp.
Okay.
Sharp.
Okay.
Dull.
Good.
Dull. 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 Sharp.
I'm going to go ahead and press down a little bit over here on the right upper side. And I'm just trying to see if there is any pain or tenderness. Okay, so no signs of any pancreatitis, no liver inflammation. Ovaries also are normal in size. I'm not feeling any fibroids. Okay. Okay, I'm going to perform some skin pulling therapy. So what it does, it helps to increase circulation in certain areas, which I think you'll benefit tremendously from the symptoms that you're experiencing. All right, so it's going to feel like a pulling sensation.
Okay.
Okay. Any pain?
No.
Okay, so that is all that we're doing for today. And I'm going to go ahead and avoid that area just to not cause any discomfort.
All right.
But the treatment that we're doing on all the sides will definitely benefit the left upper side as well.